All right, let's talk about these extracellular solutes. One of the things that we put in the book this year is the idea of the basic metabolic panel or basic metabolic profile, also called a Chem 7. So you go and you get a blood test. Here are the big 7 that they measure right here. Okay? Here are the big 7. And we're going to put them in this little format, this little tree or diagram, whatever you want to call it. Upper left will be sodium, lower left will be potassium, middle will be chloride, bottom middle will be bicarb. Then we have blood urea, nitrogen, creatinine, and glucose. Okay, so that's the basic setup, that's the basic format. These brackets just mean concentration. Now what we're going to do is I don't ask to memorize much, but you know what? I would memorize this if I was taking step 1. It's only 7 numbers. That's it. Only 7. You don't have to memorize it because you can pull down a drop-down menu to look at normal values. Okay? So you don't have to. But it will make you more efficient. More efficient because these are very common. Exactly. You don't have to keep looking at the chart, which takes time. You can look at things, bam, very quick, very quick. And you know what? It's real easy to memorize these. Can you remember 4? 4. The number 4. We have 4 electrolytes and 4. So what are the normal numbers? Sodium is 140. Potassium is 4. Chloride is 104. Bicarb is 24. It's the law of 4. Because there's 4 electrolytes, 4, man, 4s are wild. 4s are wild. Makes life easier. Makes life easier. Normal blood urea nitrogen is 15. Creatinine is 1. And glucose is 80. Now, you should have some idea of the normal range. Okay? You should have a rough idea. And the easy way to remember that is, hey, if it's a small number, it has a small range. All right? If it has a big number, it has a bigger range. Makes sense. Makes sense. So in other words, you know, if you have a potassium of 6, woo, that's out of the normal range, even though it's only 2. If you have a sodium of 142, no big deal. That's normal. That's good. It's all good. It's all good. Now, I do want to caution you about this one, chloride. Chloride gets a little tricky because they're starting to utilize different electrodes for measuring it. So I would check that right as I got into the step exam. I'd pull down the menu. I'd say, what do you call a normal chloride? They should say 104, but sometimes it gets a little tricky. Okay, just be prepared for that idea. All right, now all of these electrolytes are in milliequivalents per liter. BUN, creatinine, and glucose are measured in milligrams per deciliter. And a deciliter means per 100 mil, per 100 mil. And you may see it in a clinical vignette on step 1. Patient X has a glucose of 80 milligram percent. 80 milligram percent and milligram per deciliter mean the same thing. Percent is per 100. So if they say 80 milligram percent, it's the same as 80 milligrams per deciliter. All is good. All is good. Okay? These are 7 very common electrolytes. This doesn't take up much room in our brain. And once you get it down, the law of 4, it's the law of 4, it's the law of 4.